Hello and welcome to another in the series of acute medicine quizzes for the acute medicine students at the Royal Free and elsewhere. My name is James Piper. I'm a clinical teaching fellow in acute medicine. So as a reminder, these are the fourth in a series. You can do them in any order and the answers are separate on YouTube and Moodle. As usual, there are images, ECGs and lab results. There will of course be a separate video which will go with the answers, but there's also a Q&A on the Moodle section under acute medicine if you have any questions about any of the topics covered, or of course you're welcome to contact me directly. Question 1. A 75-year-old admitted to the acute medicine unit has a long-term catheter in situ for an enlarged prostate. His accompanying carer says he is increasingly confused. His blood pressure is 105/80 with a heart rate of 110 beats per minute. His CRP is 175. His temperature is 38.3 degrees Celsius. Which is the single most appropriate antibiotic therapy in this case? Is it A, IV comoxiclav, B, oral augmentin, C, IV gentamicin, D, IV piperacillin tazobactam or tazocin, or E, oral fosfomycin? Question 2. A patient is discharged from the acute medicine unit after a medically treated non-ST elevation MI. His discharge medication includes clopidogrel. Which of the following drugs is most likely to reduce the effectiveness of clopidogrel? Is it A, rifampicin, B, omeprazole, C, diclofenac, D, warfarin, E, theophylline? Question 3. An 80-year-old female is referred to acute medicine after an overdose a few hours ago. She is nauseous and vomiting. Her urea and electrolytes shows a hyperkalemia of 8.0 millimoles per litre. An ECG is taken and is on the next slide. Which drug has the patient overdosed on? This is the ECG here. Pause here if you need to study the ECG. So, which drug has this patient overdosed on? Is it A, aspirin, B, carbamazepine, C, lithium, D, digoxin, or E, indapamide? Question 4. A 40-year-old presents with a swollen red right lower leg. Which organism is most likely to have caused this? Is it A, Streptococcus pneumoniae, B, Erysipelathrix rousseau-pathiae, C, Streptococcus pyogenes, D, Mycobacterium pyogenes, or E, Pasteurella multocida? Question 5. A 19-year-old medical student returns from South America and presents to the emergency room. She is referred to acute medicine with dysphagia. A barium swallow shows a bird beak appearance. There is a grossly distended abdomen and tender abdomen. An abdominal x-ray and the barium swallow are shown on the next slides. Which is the single most likely organism responsible? This is the patient's barium swallow here, and you can see hopefully why it looks like a bird beak. On her abdominal x-rays, hopefully you'll be able to appreciate the grossly distended bowel loops here. So question 5 is, what's the organism? Is it A, Trypanosoma gambiense, B, Trypanosoma cruzi, C, Leishmania brasiliensis, D, Clostridium tetani, or E, poliovirus? Question 6. A 23-year-old presents to acute medicine with an acute exacerbation of asthma. She seldom uses her salbutamol inhaler and had no previous admissions. Her temperature was 37.2 with a heart rate of 120 beats per minute. Her respiratory rate was 30 and oxygen saturation 93% on air. Her peak expiratory flow was 40% of her predicted. ABG recorded a pH of 7.35, a PO2 of 10.5 kilopascals, and a PCO2 of 5.51 kilopascals. What level of severity is this exacerbation of asthma? Is it A, mild, B, moderate, C, severe, D, life-threatening, E, near-fatal? Question 7. A 47-year-old woman was referred with reduced level of consciousness. She had a history of esophageal cancer with known metastases to the lung and liver. She had become increasingly unsteady and fallen twice. She had a long-standing DNA CPR order or do not attempt cardiopulmonary resuscitation order. A CT head showed multiple brain metastases with cerebral hemorrhage. She was unconscious with a fixed and dilated left pupil. What is the single most appropriate management strategy? Is it A, end-of-life care, B, intravenous dexamethasone and phenytoin, C, intravenous fresh frozen plasma, D, intubate and refer to critical care unit, or E, refer to neurosurgery? Question 8. A 18-year-old is admitted to acute medicine following a severe asthma attack. On the way to the respiratory ward, he developed sudden worsening shortness of breath and pleuritic chest pain. Which of the following investigations would confirm the most likely cause of the pleuritic chest pain? Is it A, CT pulmonary angiogram, B, peak flow measurement, C, a chest x-ray, D, arterial blood gas, or E, echocardiogram? Question 9. A 70-year-old frail female is readmitted following a recent discharge with cellulitis of her left leg. She has a sudden onset of chest pain, shortness of breath, a cough with hemoptysis. Her hemoglobin is 9 grams per litre, white cell count 13, sodium 141 millimoles per litre, potassium 5.2 millimoles per litre, urea 21 and creatinine 190. Which of the following should be used to confirm the underlying diagnosis? Is it A, CT pulmonary angiogram, B, ventilation perfusion scan, C, D-dimer blood test, D, chest x-ray, or E, echocardiogram? Question 10. A 30-year-old female presents to the emergency department with lethargy and a 2-week history of weight loss. An ECG shows a right bundle branch block. The blood test showed a sodium of 130 millimoles per litre, potassium 7.6 millimoles per litre, urea 5 millimoles per litre, and creatinine 80 millimoles per litre. There were also normal thyroid function tests. Which is the single most appropriate next step? Is it A, take a serum glucose, B, perform a urine dip, C, administer intravenous insulin, D, administer intravenous calcium, or E, administer intravenous fludrocortisone? Question 11. A 35-year-old presents to acute medicine with shortness of breath. His chest x-ray is on the following slide. His saturations at rest are 95%, but when he mobilises, his saturations drop to 85%. He appears cachectic. What is the most likely diagnosis? This is the patient's chest x-ray here. Pause here until you think you have the idea of what the organism might be or the diagnosis. Is it A, metastatic malignancy, B, bronchopulmonary aspergillosis, C, atypical pneumonia, D. Advanced HIV infection, or E. Idiopathic pulmonary fibrosis? Question 12. A 59-year-old with COPD is admitted to acute medicine for the 5th time in 2 months with sudden onset, shortness of breath and palpitations whilst out shopping. There was no increase in wheeze or change in colour of sputum. A chest x-ray and ECG is normal. She feels she needs a further course of steroids and antibiotics. What is the single most appropriate management plan? Is it A. Request an echocardiogram, B. Discharge from hospital without further management, C. Discharge with antibiotics and steroids, D. Commence a further course of steroids only, or E. Prescribe low-dose lorazepam? Question 13. A 28-year-old is admitted with acute severe asthma. You review him in resus with the acute medicine registrar. He has a tremor. His chest x-ray is normal. His CRP is 4. His admission lactate was 2.5 millimoles per litre. You repeat it before he goes to the ward. It is now 6.3 millimoles per litre. You re-examine his chest and there is a mild generalised expiratory wheeze. What is the single most likely cause of the elevated lactate level? Is it A. Mesenteric ischemia, B. Near fatal asthma, C. Sepsis, D. Salbutamol toxicity, or E. Tension pneumothorax? Question 14. A 56-year-old woman is referred to acute medicine with severe chest pain. The pain was central and radiated to the back. She has a history of hypertension and a 20-pack year history. Her heart rate is 92 beats per minute and blood pressure of 170 over 90 millimeters of mercury. Cardiac and respiratory examinations are normal. Her chest x-ray is normal and her ECG shows sinus rhythm. Her D-dimer was 40,000 and troponin 50 nanograms per litre. Which is the single most appropriate treatment? Is it A. ACE inhibitor, B. clopidogrel, C. low molecular weight heparin, D. percutaneous coronary intervention, or E. urgent surgery? Question 15. Which of the following is a contraindication to inserting a nasopharyngeal airway? Is it A. warfarin, B. previous nasal fracture, C. nasal polyps, D. rhinitis, E. known base of skull fracture? Question 16. What is the single most appropriate method of administering 24% oxygen? Is it A. 2 litres of oxygen via a nasal cannula, B. 2 litres of oxygen via a Venturi face mask, C. 4 litres of oxygen via a plain face mask, D. 4 litres of oxygen via nasal cannula, or E. 2 litres of oxygen via a non-rebreathe mask? Question 17. A 75-year-old is admitted for an emergency gastroscopy. To reduce anxiety, 3 milligrams of intravenous midazolam is admitted as a bolus. She becomes drowsy and shows signs of airway obstruction. What is the single most appropriate management plan? Is it A. insert oral pharyngeal airway and high flow oxygen, B. high flow oxygen, C. flumazenil, D. naloxone, E. intubation and ventilation? Question 18. A 56-year-old is reviewed in acute medicine clinic for a suspected transient ischemic attack, or TIA. What should you advise him about driving? Is it A. he can carry on driving, B. he mustn't drive for 4 weeks, C. He can only drive a car but not a heavy goods vehicle. D. He must give up driving. Or E. He must not drive until his MRI head results. Question 19. An emergency endoscopy is performed due to an acute upper GI bleed. On the next slide is a picture taken at endoscopy. What is the single most likely diagnosis? Is it A. gastric ulcer, B. gastric cancer, C. esophagitis, D. esophageal varices, or E. venous malformation? And finally, question 20. Which of the following is not part of a routine confusion screen? Is it A. B12 and folate levels, B. CT or MRI head, C. calcium levels, D. syphilis serology, or E. thyroid function tests? Okay, well done for getting through those questions. Hope you found them okay. Some of them are harder than others. A explanation video and document will follow after this video. Good luck.